Good afternoon. My name is Bethany Koshinsky, and today I'm going to be talking to you about the Transtheoretical Model. This is Nursing 510. First, we'll talk about theory description. What is the purpose of the theory? The purpose of the Transtheoretical Model is to help individuals achieve behavioral modification by gearing interventions toward the respective stage of the process. The stages will be described on the following slide. The scope and level of the theory. As the title suggests, the Transtheoretical Model was constructed based on a meta-theoretical approach, as it focuses on broad issues and abstract issues. The theory was constructed with an integrative approach of various psychology theories from Freud, Bandura, and Skinner, just to name a few. In order to help link concepts between the vast array of fragmented theories in psychotherapy. The origins of the theory. The Transtheoretical Model was developed utilizing various social theories in the 1970s in order to understand the process of smoking cessation and an individual's intention to modify their behavior. The context of use is pretty broad, as mentioned earlier, but while the theory was originally utilized in the context of smoking cessation, it is involved to encompass various behavioral modifications that influence one's health, and those will be described on the following slides as well. This is a breakdown of the stages of change, and we'll talk a little bit about these different stages of change. The first stage is called pre-contemplation. The person is still in denial. In an article by Evers et al., 2006, the participants in the study in the pre-contemplation stage were not considering implementing positive modifications within the next 6 months. So this is when someone is completely in denial, they don't want to admit they have a problem, they don't want to hear it. Contemplation is the next stage, and this is when consideration of change with a goal of 6 months or less. So someone is beginning to think about change, maybe in the near future, they're still thinking about it, they're not really sure what they want to do. Preparation is the next stage. An individual has decided that they are going to change and has a goal of obtaining it in the next months. So this is when they're starting to get ready, they're, gung-ho, it's their New Year's resolution, and they've decided that they're gonna make that change. And then action is January 1st. We're ready to go, we're ready to make that change. Individuals are actively making positive behavioral lifestyle modifications for a period of time, usually 6 months or less. And then maintenance, I started making that change. I've been going to the gym 3 to 5 times a week, been getting my exercise in, and the change has been ingrained as part of a routine and has been actively integrated into one's life for greater than 6 months. There's also another stage which has been kind of debated, but that stage is called termination. The negative behavior is not an issue anymore for the patient. There is lack of temptation. And when we're talking about this from a behavioral psychology standpoint, most of these are always going to present a challenge throughout someone's life. So this has been a topic of debate. There's also a concept of relapse. So say I made it to the action stage and it's January 1st and I'm ready to go. I've been living my healthy lifestyle and someone invites me out to dinner, and then I decide to eat this really good ice cream, and then I stop going to the gym, and then I revert back. So that is the concept of relapse. Other concepts which are included in this theory are also decisional balance. And decisional balance is the mental contemplation one undergoes while determining the advantages and the disadvantages of changing. I like to think about this in terms of your little angel on the one side and then your little devil on the other side. One is saying, yeah, it's good, you should go for it, and the other one's saying no, and you kind of just have to weigh the pros and the cons. Self-efficacy is another huge concept which has been taken from Bandura's theory, and self-efficacy is one's belief of their control over a situation. Temptation is another thing which can influence whether one relapses or not, and this is the influence to revert back to a previous stage. The next concept which has been added, or series thereof, is the process of change. I liked this quote that change is a process and not an event. So they determined that there were 10 different processes that also impact whether one makes it to the different stages of change. The first one is consciousness raising, and I put this in a little breakdown for a scenario for you to help you understand. So consciousness raising, I become aware that my excessive ice cream consumption is affecting my health. And I really do like ice cream, so this part is true. Dramatic relief. When I find out I have diabetes as a result of my sugar intake, I become upset and ready to stop eating Ben & Jerry's. So I have an emotional connection to it. I've realized I've been diagnosed with a chronic disease. So I decide to reevaluate my environment. I realize that having ice cream in my immediate surroundings in the fridge contributes to my addiction, so I don't buy it anymore. Social liberation. My nurse educator realizes the increasing prevalence of type 2 diabetes in relation to ice cream addicts, and posters are hung in schools to reduce ice cream and sugar consumption in the hopes thereof. Self-reevaluation. While I was sad at first, I had to decrease my ice cream consumption. I now feel more healthy and energetic, and my blood sugar control has been stabilized. So I've been reevaluating kind of my process this far, and I think I'm doing pretty well. Stimulus control. I no longer go out to Ben & Jerry's with my friends. Helping relationships. My friends and family understand my problem and don't bring me ice cream anymore. Counter conditioning. I have replaced my ice cream with a natural sugar, including Greek yogurt and no artificial sweetener, with fresh raspberries. Reinforcement management. Since I haven't eaten ice cream in 6 months, my family takes a trip to the beach to celebrate. Self-liberation. When I go to the doctor and my type 2 diabetes is now under control, I feel empowered and committed to maintaining this lifestyle modification. Again, this is just an example to help you see kind of the breakdown of the different processes. I do love ice cream, but the other parts are not necessarily true. Theory analysis. The concepts in this theory, we're going to talk about how they're defined. While there is guidance for the various stages, there is not a clear and consistent definition to delineate the differences between the various stages. Since people may differ in their readiness to change, some may revert back to previous stages. The concepts do not have a set timeline for each stage. The concepts also do not mention a set age range for the model. The model also assumes that individuals have the cognitive ability to make informed decisions. There is no set definition that eliminates people with dementia or mental debilitating illnesses that may not be able to make a conscious decision. Theoretical and operational definitions. Since the transtheoretical model is broad and covers a broad spectrum of health behaviors, Prochaska and Velisser, sorry if I'm saying that wrong, in 1997 provide theoretical definitions which can elicit various research studies. The stages of change, therefore, can be applied to various settings. And in the following slides, we'll talk about some of these different settings which they've been utilized. The linkages between the concepts. Interactions. In this theory, the concepts evolve through a process of self-awareness and self-actualization to allow the person to make a positive change. However, without introspection or education, the individual may never progress past pre-contemplation stage, as they are unaware that there is even a problem. Every stage except termination has the possibility of reverting to the previous stage without consistent support throughout the behavior modification. While the interactions between the concepts are logical, there is not a clear cycle between stages. According to Prochaska and Valisser, 1997, people often relapse to earlier stages. However, while one may be in the action stage and revert all the way back to pre-contemplation, another may go from action stage back to contemplation. Theory analysis. While the theory flows through a series of stages, it is broad and unique in application to individuals. Therefore, one may not think it is organized. However, this framework is important for interventions. It relates to, since there is no set algorithm for behavioral modifications, as people progress differently based on influencing environmental factors. There is a model, which was depicted on slide 3, which describes the theory. And as it is defined, the Transtheoretical Model is actually a model rather than simply a theory. It's a combination of multiple psychotherapy theories. And this describes the various stages an individual must go through in order to reach the outcome. Is the theory consistent and the outcomes clearly stated? Unlike traditional theories, which normally define a more narrowed outcome, the Transtheoretical Model includes multiple outcomes throughout the process of change. And that's important for nurses also to consider, or whoever is caring for the person as they progress throughout the change, that the outcome for someone in the pre-contemplation stage may be different for the person that's made it to the action stage. So as we talked a little bit about nursing interventions in the previous one, that it's important for nurses to consider different outcomes, this theory is very applicable to nursing interventions and has been used in nursing research thus far. According to Prochaska and Valisser, 1997, the model assumes that interventions should be geared towards one stage. Nursing interventions, I provided just an example on here, would be a diabetic educator. Nurses are always educators no matter what setting that they're in. So this is just one example how a nurse may have to consider these different stages that a patient may be in when they're accounting for the education of a diabetic patient. Does the research support the use of theory in practice in education? While the model was originally utilized for smoking cessation programs, it has now been widely implemented in research studies throughout various health promotion interventions, including exercise, sexual health, and use of sunscreen, just to name a few. It's also been used in diabetic research also. As type 2 diabetes continues to become more prevalent in society, this is something really to keep in mind, as we've noticed that lifestyle modifications can greatly improve one's outcomes. So the theory does not specify cultural norms or socioeconomic factors which may impact one's intention to change. Since the model does not define a specific cultural context, it has been used in settings in which the researcher wants to study large populations. Valisser et al. 2000 suggests there are several key areas for health promotion education. And nurses, again, play a huge role and are at the front line when it comes to helping population achieve outcomes. Just to name a few, these are some different areas in which this model is applicable and has been studied. Weight control, exercise, increasing fiber, drug use, as you can see, sexual health, and mental health. So with the increasing awareness of preventative medicine and healthcare, the belief of the Transtheoretical Model is immensely applicable to nursing practice. Using the Transtheoretical Model for population-based approaches to health promotion and disease prevention. I have seen this theory used in nursing practice from my personal experience also. Having worked with wounded warriors suffering from traumatic, life-altering events, I have realized that interventions are most successful when geared towards the stage of change. As the diagram shows, this model can be utilized in various settings of nursing practice. To break it down, the next 3 slides, I'm going to describe a couple of different research articles which have been based off of the Transtheoretical Model. According to the World Health Organization, in 2017, depression affects over 300 million people worldwide and is the most significant contributing factor to disability. Symptoms of depression include lethargy, feelings of despair, lack of interest, interrupted sleep cycle, and diet. Levy et al. Applied the Transtheoretical Model to improving outcomes for depression. This article examines the effect of social marketing with the utilization of the Transtheoretical Model to develop websites which disseminate mental health awareness and persuade people to engage in depression prevention and seek help if needed. As you can see on the picture to the right, depression often presents itself very differently, and you don't always know that people are depressed. A lot of times people may be feeling many different ways, but the common saying is, I'm fine. No one wants to admit that they're going through this internal battle or struggle. So applying this, the article broke it down into the different stages of change. In pre-contemplation, the person is in denial of their mental health condition. So they developed a website intervention which focused on consciousness raising, in which it explained the symptoms and self-assessment tools for people to go through and evaluate their own self to see if they were having any symptoms. Contemplation is the next stage. The person admits they have depression and they see the impact on their life. They begin to consider taking actions to improve their health. For this section, the website intervention focuses on providing available resources so the person can consider whether this is something they have power of, and then they can gain more self-efficacy. The next stage is preparation, and the person is ready to commit to making behavioral modifications. The website intervention focuses on encouraging counter-conditioning and implement positive new behavior rather than negative behaviors. Action is the next stage, and the person makes changes. The website intervention focuses on raising awareness of potential triggers to old behaviors. It focuses on enhancing positive thoughts when cycling through negative thoughts. And that's also called counter-conditioning, as we learned earlier. Maintenance is a sustained commitment to the treatment plan. According to Levy et al. 2015, with depression, this phase continues throughout one's lifetime. So the website intervention focuses on reducing stigma associating with relapse and helping the patient really learn from that experience and do things differently the next time that it encounters. In this article, termination was not part of it because, again, with depression, it often presents itself throughout one's lifetime. The next research article which I found, which has been highly studied, is the application of the Transtheoretical Model to exercise. According to Huang et al. 2015, while heart disease is the leading cause of death worldwide, regular exercise has shown remarkable improvements in outcomes. Huang et al. 2015 conducted a study on 130 patients following open heart surgery to examine the compliance to exercise for a sustained period of 6 months. Participants were given a questionnaire prior to the surgery and 6 months after to examine their level of readiness in terms of complying to the exercise regimen. While gearing interventions towards the individual's level of readiness, the study found at 6-month follow-up that the majority of patients that were in the contemplation stage, which was around 40%, or the maintenance stage, which was around 40% also, were moving towards the action phase. The next research study that I found focused on skin cancer and in application to the Transtheoretical Model. So it talked about sunscreen to minimize the risk of skin cancer. After recognizing the detrimental impact of skin cancer, Yusufov et al. Conducted a study of over 3,000 adults by implementing a computer intervention system to elicit change in behavior. Yusufov, 2015, found through the study that the most important factors for change were raising awareness about negative impact of excessive sun exposure without sunscreen, which raised their consciousness of the problem, avoiding or countering stimuli that elicit the problem or behavior, which focused on stimulus control, rewarding oneself for being rewarded for making changes, reinforcement management, and choosing and committing to believe in one's ability to change, so self-liberation. While Yusufov focused on the importance of raising awareness for sunscreen, I also found another article which was really interesting to me, having gone through finding out that my sister had been diagnosed with melanoma. So a study conducted by Moore, 2012, found that hundreds of middle schoolers use ultraviolet imaging technology to show that skin damage can happen early in life. A dermatologist, Robert Delavelle, highlighted that even children as young as 2 show signs of skin damage. So in this image that you can see behind here, the woman, just looking at her without the ultraviolet light, you don't really see too many freckles, and it looks like she doesn't have too much skin damage. But with the ultraviolet light, you can see significant damage to her skin. And this has had a profound impact on really raising awareness for kids, because I think that's when peer pressure seems to be the most for having that nice tan, but they don't necessarily realize the impact that it can have on them long term. So current versus future utility of the theory. While currently the theory has been researched primarily with behavior modification strategies, from healthcare provider interventions at visits and public health announcement, the theory is on the brink of significant change. With the advancement of technology and continuous feedback from electronic devices, patients will have increasing awareness of their current health status. Fitbit technology is just one of the many electronic devices which are leading the way in showing objective physiologic measures. Some apps now are even allow the provider to view live information from the patient's phone, which is linked to the patient's electronic medical record. One app in particular was created by Heart Failure Society of America 2018 and helps track medication compliance, symptoms, vitals, exercise, diet, and mood. This app also has the technology to sync to the provider. Maybe with this up-to-the-minute feedback, the patient will be more willing to make change. Okay, so the next thing that I have here is just a breakdown of the different stages with an example here. So future research, as I said, is on the brink of advancing with technology that we have available to us now. So I have a little scenario of something that may be in the future studied more. Pre-contemplation, a young adult develops cancer. He is very upset and does not want chemotherapy. The nurse explains to him that there is a new innovative video game that shows what chemo does to help destroy cancer. The young adult plays the game and decides he is going to begin treatment. The young adult starts the protocol. The young adult has been adhering to the chemo protocol for at least 7 months and has a positive attitude about a cure. According to DeVlisser, 2008, the theory was originally developed to integrate various theories. However, new constructs can always arise and will need to be tested, resulting in the need for modification of the model. Pam Omidyar helped develop a video game technology to improve compliance for cancer treatment. Hope Lab 2018 found the original remission game improved treatment adherence and boosted self-efficacy in young cancer patients. The study utilized fMRI technology to demonstrate the positive impact the games had on the brain to produce behavioral modification. Since technology continues to evolve, this will be a new form of counter-conditioning. However, the efficacy of the technology will need to be studied. For this example in particular, the model would need to be more defined in terms of age. Do children and young adults differ in stage of process of change as their consciousness and awareness may not be developed as much? Also, for a young adult, is the process shorter in duration since habits may not be ingrained? Other factors which would need to be considered would be influencing socioeconomic factors limiting treatment. Biologic factors would also need to be considered, such as predisposition for depression and anxiety, as life-altering events such as cancer could impact one's willingness to comply with treatment and perceived control. While the Transtheoretical Model is broad and does not specify specific culture or population, it may be important to consider political structure of one's environment. In America, we have freedom of choice. But this theory may not be as applicable to a dictatorship when people do not always have a choice over their behaviors. Behavioral modification revolution. While this theory has helped lead the way for various evidence-based studies to date, as science and technology evolve, the theory may need to be modified. According to DeVlisser, 2008, the theory was originally developed to integrate various theories. However, new constructs can always arise and will need to be tested, resulting in the need for modification of the model. Here are my references. Thank you for taking the time to view my presentation. If you have any questions, please feel free to reach out. Hope you have a wonderful day.